India is going to the cardiac disease capital of the world. We have around 32 million cardiac patients in India today, and this is expected to grow to 70 million people in another 12 years. The people who are necessary for solving this cardiac problems is cardiologists, and we have only 6,000 cardiologists when the need is around 60,000. The complication doesn't end there. 98% of the cardiologists that I showed just now stay in the cities, and 15 million patients who have these problems stay in rural areas. There's a huge accessibility problem. Next problem is that the most important diagnostic equipment, an ECG machine which is necessary to do the cardiac diagnosis, is very costly. And that comes from $1,000 to $3,000 if you need a good machine. So what are the key issues that you're trying to see? One is affordability. So we need to provide a method to provide cardiac diagnosis in an affordable manner. Two is accessibility. You can't just get a printout of an ECG and then expect that would solve the problem. We need to connect a cardiologist to give diagnosis. And at the end of the day, we need to provide a complete care cycle where the patient who comes with a cardiac problem can walk out with the prescription for the problem. So these are the problems that we're trying to solve. So we present Dhilcare. We make an affordable mobile phone-based ECG machine with a mobile platform that will enable a general physician to provide cardiac diagnosis with the help of a cardiologist. And in this way, we're able to provide remote, life-saving cardiac diagnosis. These ECG machines have been there for a really, really long time. So what is new in our machine? What we did was, we looked at all of these ECG machines and found that all of them have a printer, a display, a communication module, all of them put in a big box. We looked at it for some time, and what we did is we knocked off the printer, the display, and the communication module. All of them are put now into the mobile phone. So only the crucial ECG acquisition device is kept into that place. So this is the 12-lead diagnostic quality ECG machine that we're going to release, which will be medically certified. This can be carried just like a stethoscope by the doctors on the clinics. What our product offering is this: a device which will do the core lead acquisition, which we think can be placed on every general physician's table just like a stethoscope. If you see, look at the table now, there's a BP monitor and there is a stethoscope. The next thing that has to be there on the table is an ECG device, and for that we need Dhilcare. There's an application that we're developing which is as simple as a WhatsApp to use, because most of the times the people who use these devices are not doctors. They are the 8th standard or 10th standard pass students who take a job with the doctor. So this application that allows them to transfer details is also made very simple to use. The market opportunity is really huge in this place. We have around 6 lakh people, and a huge market opportunity that you can see. We have presently completed a prototype, and we're going to start a pilot in China, in Chennai, as well as in Trichy, and post that we'll be launching with certification in next April. So we are based out of IIT Madras, and I worked in Philips Healthcare. My friend worked in healthcare technology and rural technologies for some time. We have a good team of advisors with cardiologists and diagnostic chain CEOs who are helping us in this process. This is the thought I want to leave you with for today. Thank you.